Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates. With your host, Cindy Gellermini.
Hi, everyone. This is Cindy with another episode of Spectrum Perspectives. And today we have Dr. Neuenschwander with us today. Hi, Dr. New. How are you?
I'm doing great. How are you?
So I'm happy to have you here. So I interviewed Honey Renicella a couple interviews ago when I got on my path of talking about spelling to communicate. And we learned from her that she's involved with MedMaps, and we learned about seizures and things like that. So I wanted to have you on. We had Dr. Usman on. She's part of MedMaps as well.
Yes.
But I think this is your baby, isn't it? This is
It's a baby I adopted.
right. Yeah. So tell us a little bit about what kind of doctor are you? What do you do? How does it relate to autism? Tell us about MedMaps. Tell us the whole story.
Sure. Well, no, I always love the question, what kind of doctor are you? Because my answer is always a really good one. No, I actually graduated from medical school a long time ago at the University of Michigan and went into a general surgery residency because it was fun and you actually remove disease from people. But, you know, somewhere in my third year of general surgery residencies, I had an epiphany that, you know, I actually went to medical school to learn how to cure people, and they just don't teach you that, right? They teach you, you know, drug, surgery, radiation. That's what you learn in medical school. So at that time, I had hooked up with a naturopath, with an herbalist, a homeopath, learned acupuncture, and sort of left that world. And also went into emergency medicine. So I'm actually board certified in emergency medicine, although I don't practice that. I haven't practiced that in about 5 years at this point. And so my practice is primarily integrative medicine. I started the practice in, good Lord, 1988. And the idea, the tagline was always healing illness at its source, find the underlying cause and go after it with that. And, you know, fast forward, it's 2005, 2006. I've got a very successful practice treating mainly adults. But, you know, one of the things that happens when you treat adults, the adult said, hey, do you see kids? And it's like, oh, not really, but I can. I mean, it's within the scope of my practice as an ER doctor. And they started talking about autism, and I'm sorry, I knew nothing about it. I mean, I went to medical school in 1981 to 1985, University of Michigan, 85 to 88 at the general surgery residency. I did not see a single kid with autism. I learned about it, but you know, at that time they were still talking about the refrigerator mother theory of autism, how, you know, that's what people thought, and that's being disproven. That's how backward things were at. And again, in 1981, I think the autism rate was 1 in 10,000. So why would I see somebody, right? So anyway, so I'm working in the ER. My wife was an ER nurse, and a friend of hers had a child who was on the spectrum. And she said, oh, how's your son doing? And basically, the long and the short of it is, she said, oh, he's recovered. And my wife went, I didn't know you could recover from a psychiatric illness, right? What did you do? Oh, we did gluten-free diet, we did chelation, we did meth B12, we did this, we did that. She's going, oh my God, that's what New does. And she came home, and I remember her looking at me going, honey, we're going to save the babies, right? And so it's like, we don't want to save the babies. I'm busy. I've already got a 3-month waiting list. You want me to see? But she dragged me to, prior to MAPS, there was an organization called DAN, Defeat Autism Now. That was the mothership of all the autism organizations. And she dragged me to one of those conferences. And I'm telling you, I just had my mind blown. You know, I love biochemistry. I love like how this causes that, how the symptom you see here is just a symptom that's actually being caused by this and this and this. And if you understand all that, then you can figure out how to treat it. So it was just mind-blowing for me to have been in practice at that point, what, 20 years, and not knowing this. I remember sitting in the audience thinking, why don't I know this? I mean, this is like every doctor should know this, not just people treating autism, but every doctor should know this for every patient they see. And that got me started with this. Dan sort of fell apart at the end of 2009, 2010. MAPS was created from, and that's the Medical Academy of Pediatric Special Needs. And our website is medmaps.org to differentiate. I guess there's a MAPS that's involved with psychedelic therapies as well. That's
Oh,
a different MAPS. I'm not the president of that one. Maybe I
okay.
should be, not. No, it's medmaps.org is us. But the idea with MedMaps was to get together, Dan was researchers, practitioners, parents, put them all in the same room, see what they can come up with. That was the idea behind it. With MAPS, it's much more, that was how Dan was formed, but MAPS is much more practitioner oriented. How do we train practitioners in, it used to be integrative treatment of these neurodevelopmental disorders. Now it's just any chronic pediatric condition is what we're talking about. So we're talking seizures and asthma and, inflammatory bowel disorders and all the gut stuff and eczema and, all the chronic illnesses you see with kids. Even, my kid gets an ear infection every other month. Well, that would be a reason to see a MAPS practitioner because we understand why they're getting it. And, we like to say they're not getting an ear infection because of an acute lack of amoxicillin or something, right? There's another cause of it.
Right.
None of these diseases are caused by the lack of a drug. There's a biochemical reason for it. And if you can understand that and treat that, you can move forward. So I got involved with MAPS when it first started in 2012. I was one of their first fellows. So I'm a fellow of MAPS. And then I became part of their executive board and ultimately became president of MAPS, I think 3 or 4 years ago now. So that's where we're at. We do a couple conferences a year. We see kids on the spectrum, but we see any kid that has a chronic condition because it's not just autism that's gone through the roof. All the other pediatric chronic conditions have gone haywire in the last, 30, 40 years. So that's what we're all about. And that's what I'm all about. I always say we're really at a war. We're in a war for the health of our kids, right? If you look at the numbers, they're horrible, right? I mean, there's 29 industrialized nations, and the United States is number 36 or number 37 for pediatric health. We have worst infant mortality. I think you can say we have worse infant mortality, meaning death within that first year, than all the other industrial nations combined. I mean, it's bad. And when we look at that, it's like, well, why? Why isn't everybody running around at the CDC and the NIH with their hair on fire trying to figure out what's going on? And they're just not. Their answer to the autism epidemic is we're better at diagnosing it. Really? 28,000% increase in autism since I went to medical school. And it's all because we're better at diagnosing it. And then I'm 64. Where's all the 64-year-olds with autism? Because I don't know any, right? And it's kind of scary, but that's what brought me into this. As I always like to say, I was brought into the world of integrative pediatrics, kicking and screaming, dragged there by my wife, but I am certainly glad that she did that and that I'm here because, the great thing about taking care of kids is you change a kid's life, you change their life forever, right? Forever. You change the way they develop, you change their ability to reach their potential, what they can be. Right. Adults, we can help people improve, but, can we really get them to what they should be? Maybe not. It's much harder with an adult.
Right. Right. I'm big on asking why. Like even when an autistic non-speaking kid says, is having behaviors, why? Well, why? What's causing the behavior? You have to ask that. And sometimes you don't find out until they learn how to spell, what's really going on. So what, in your opinion, is causing the epidemic of autism? That's a loaded question.
Did I?
And be careful you don't use the V word.
No, did you? I didn't think we booked 6 hours for this discussion. Look, I really think, and one of the problems, anytime you have spectrum disorder, right? It's not a diagnosis, right? It's a description of symptoms. So you have a group of people.
It's diagnosed by just their behaviors, basically.
Right,
There's no blood test or anything.
And this is psychiatry. This is psychiatry, right? That if you have 2 of these and 1 of those, you have depression. But if you have 1 of those and 2 of these, you're schizophrenic. That's psychiatry. And so, to be autistic, you just have to have issues with, your social interaction. You have to have atypical behaviors, and you have to have problems with speech. That's autism. So what does that mean? I have no idea. So what I'm looking at, because I mean, in Michigan, we do try to get the diagnosis of autism because it opens doors for therapy, right? That's the only way to have that diagnosis.
Right. I personally think that it should be separate diagnoses. Somebody that at my son's level who still wasn't potty trained at 27 years old, absolutely needs support in every aspect of his life, is not the same as somebody that has a master's degree,
No, I understand.
you know?
And this,
But the reason that they like it all lumped together is like you're saying, because then they can get the treatment that they need, right? But why can't we come up with a different name diagnosis for the different?
well, and
That's just me.
no, but look, it's the nature of psychiatry. So, when you, my example is always, you wake up in the morning, you have a cough, you're coughing up green loogies, you got a fever, you got pain in the right side of your chest, you go to your internist, they listen to you, they get your history, do a chest x-ray, a blood count, they get a sputum sample, they say you have a right lower lobe pneumonia with strep. Put you on antibiotics, you're better in a few days, everything's hunky-dory. That's a diagnosis, right? I like to say you go to the psychiatrist with the same set of symptoms. They listen to your story, as I like to say, with great empathy, and then they diagnose you with right lower lobe, cough, chest pain, and green loogie syndrome, or disordered, right? And then when you ask, oh, I heard antibiotics can help that, they correctly say, no, not really. Why? Because most pneumonias are viral. They don't respond to antibiotics, right? So, this is the whole problem. If you don't investigate, if you don't look at what's causing the problem, how would you know? So again, back to this whole idea of what causes autism. I think there's a chunk that is genetic. Now, you don't ever have a genetic epidemic, right? Genetics, the incidence is level. I mean, just look at Down syndrome, right? That hasn't changed, right?
Right, exactly.
Yeah, so we know this is not simply genetic in the classic sense, but if you look at the genetics of kids that have autism, what do they have? They have problems with their methylation pathways, they have problems with detoxification, they have problems with the genes that make connections inside the brain, they have problems with just inflammation in general. They tend to generate more inflammation. So what does all that mean? So, again, we're back to what is autism from a biochemical point of view. And we have some clues. There's no 100%. 100%. The saying is, if you met one kid with autism, you've met one kid with autism. I mean, you don't know anything about autism. You can't generalize. But the issue is that we've got at least 65 to 70% of kids on the spectrum have evidence of brain inflammation. All right. And it's not just brain inflammation, it's autoimmune brain inflammation. And this is based on an autopsy study where they looked at brains and they said, yeah, there's actually damage to the brain from this inflammation. And the cells that are in there are not from infection, like, West Nile virus or something. The cells that are in there are autoimmune type cells. So this is an autoimmune encephalitis 65 to 70% of the time. What else do we know? Well, if you talk to Dr. Guzman, you know that 75 to 80% of these kids have autoimmune antibodies to their folate carrier. They don't transport folate into their brain. We also know that a lot of these kids have methylation disorders. Everybody says, oh, I have MTHFR, I must be autistic. No. That's MTHFR is not the same as methylation. There's a whole bunch of things. It's one of many genes involved in that process. But if you have issues with methylation, it means you don't detox well. You don't change around your brain chemistry very well. You have problems breaking down hormones. It creates all kinds of issues for you that can be interpreted as, this behavioral problem that we're going to call autism, right? And then you've also got just the issue of toxicity. So back to the question, what causes autism? My answer is toxicity. All right. I really think that you have a system that can tolerate so much toxicity, and it just didn't have to deal with that much toxicity. But we're doing one of these numbers with what we're exposing our kids to, and ourselves, by the way. It's not just our kids. We have an epidemic of obesity. I'll clue you in. It's not because of Lay's potato chips and Coca-Cola. All right. It's all about the toxicity of the food, the toxicity of the environment. And the trouble with kids, you're also talking about, toxins that are in, look at baby formula. Try to read a baby formula label and tell me you can pronounce 90% of what's in there. Right. And then we've got the issue of injections. We've got the issues of medications. Again, if your answer to every symptom is a pharmaceutical, and I'm not bashing drugs, I think they can be very life-saving, but if you're going to put a kid on a pharmaceutical for a long period of time, that pharmaceutical is going to have toxicity associated with it. They all do. And then does the toxicity of the pharmaceutical outweigh the benefit? And frequently it does. right? And that's part of why we're seeing this trend overall. Our life expectancy peaked, it's coming back down. And it's because your average adult is on what, 3 or 4 medications. And I think something like 20% of all kids are on medications. When did that start?
Mm,
Right? It wasn't like that when I was in medical school, right? So
mm,
again, you have to look at this picture of toxicity. Toxic foods, you probably know the autism diet, yeah. So what's the autism diet? It's going to be like grilled cheese and Cheez-Its and fruit roll-ups and
chicken
just
nuggets and French fries.
chicken
That's it.
nuggets from McDonald's.
Yeah.
Okay, so do the
Yeah.
right plug here.
Right.
It's like garbage. It's
Hmm.
total garbage food that's addicting. And
Yes.
and the problem is, it's like your kids are on heroin, and as long as they're eating this stuff, they're just making their autism worse.
Mm,
Right. And so for me, the biggest thing we can help parents and help kids with is, how do you detoxify that kid? How do you change their diet, get them on food that's going to support them, get them off food that's making them worse? How do we get rid of some of the toxins? Back when I first started this stuff, methyl B12 shots, put them on gluten casein-free diet, get them some chelation. You probably cured 50% of the kids you saw, not anymore. I mean, it's gotten a lot more complex. And I think part of it is generational toxicity, right?
mm,
Because, kids born today, they're born with whatever the toxicity mom had in that moment. But what mom has is whatever toxicity she's developed in her entire life. But remember, the ova, the egg that became that baby, she had when she was born. So it's dependent on grandma's toxicity too.
wow.
Right.
Yeah.
So, if grandma has some toxicity, she passes that on to the daughter, which is the mom. The mom has toxicity, gathers up even more during her life, and delivers that to the baby that you give birth to. And it's like, yeah, you can see how, even if that child was in a, we organic food, we have filtered water, we don't have any mold in the house, we're not doing any pharmaceuticals, we're not doing any injections, we're living a clean life. Yeah, you'll have much better outcome by doing that, but you can still have autism. All right.
Mm,
And it's probably because this vertical transmission of toxicity. They had a great study when DDT was all the rage. They did this study with mice, because the issue was reproduction, right? It was killing the birds, because birds couldn't reproduce. They couldn't lay eggs that were strong enough to, the parent would sit on the egg would smush. So what they did was, they took a litter of mice pups, and they exposed them to DDT once. All right, just at birth, they
what is
exposed.
that? Like Roundup?
Oh my God, you are so young. DDT is, pat yourself on the back. No, DDT was an insecticide. DDT is why we don't have malaria in the United States, because they just
Okay.
blanketed every swamp with DDT. It was great at killing
Oh,
insects.
okay.
But DDT also does things like causes cancer, stays in the environment forever. I mean, the
Yeah.
thing about DDT is it breaks down into something called DDE. DDE is still there. The last time the government checked it was in the early 2000s. 80% of people had DDE, and we banned DDT in 1972, 3, 4, something like
Okay.
that. So it's
Okay.
been banned for a long time, but it's
Right.
still in the environment. But at any rate, they exposed the pups to DDT, and they see, does it affect their fertility? And the answer was no. It didn't. That first generation didn't affect them, but they kept watching them. Second generation had problems. Third generation had even more problems.
Mm,
So one exposure at birth affected the descendants 3 generations down the line, right? It's the
right.
Bible, the sins of the fathers are bestowed upon 7 generations, right? Oh yeah, probably.
Yeah.
They're close, right?
Wow.
So again, we have to deal with that, and that's just getting worse. I
Yeah.
mean, we are not reducing the number of chemicals we're putting in our food, air, and water. We're increasing it. We used to say 80,000 chemicals. No, it's over 100,000 now, and they
Wow.
keep adding stuff in, right? And again, unless you have agencies that are really out to protect us, right? You have no hope,
Yeah.
because all these things are just going to be added in. It's safe and effective. It's you can add that into the water. Glyphosate is, when glyphosate first came out, Roundup, when it first came out, they actually said it was as safe as water to
Oh,
drink,
yeah. Right.
right?
Hmm.
Because we don't have the enzyme that that glyphosate affects. And it's like, yeah, but our entire gut ecosystem does, you
Yeah.
know. It just was, they were just clueless as to what this stuff did to human beings. So
Right.
but
Right.
anyway, when you have a kid, when I like you come to my office, you have the 2, 3-year-old kid, and they were just diagnosed with autism. Okay, well, let's look at clues, right? So you look at, is this like a gut kid? Oh yeah, they weren't breastfed. They were, C-section, not breastfed, colicky. We had to go through 4 different formulas before we could find something. They would scream for an hour and a half a day every day until they were 6 months old. And usually along with that, congestion, ear infections, that sort of stuff. That's a gut kid, right? Or the kid that wakes up in the middle of the night, falls asleep fine, but 2 o'clock in the morning they wake up and they're not even necessarily upset. They could be giggling, laughing, sounds like they're doing a comedy routine in their bedroom. That's usually yeast. Or they wake up and they're irritated and they're angry, and that's usually Clostridia. So again, back to the numbers, 75, 80% of all kids on the autism spectrum have gut problems. And the biggest issue is they have an overgrowth of Clostridia. And then you have another 20 to 30% where it's an overgrowth of yeast. Not 100%, not every kid, but again, that's one of the things we look at. Is this a gut kid? The second thing is this whole immune system problem. Are these kids sick all the time? How old were they when they got their first ear infection? 2 months. Oh boy, right? There's a problem, or, they had, typically it's between 1 and 2 years old. They had 6 ear infections between 1 and 2 years old, and then they put in tubes. Well, are they having ear infections because they have a tube deficiency? No, they're having ear infections because they're congested. They're not draining the way they're supposed to because you just put them on food they shouldn't eat.
Mm.
Right. And you don't, again, you don't get the connection. You have to look at that.
Mm.
Is there an immune system in the family history? Any autoimmunity? No. Any health problems at all? Well, yeah, I have thyroid problems. Oh, okay. Does your mom have thyroid problems? Yeah, and so do both my sisters. Okay, that's an autoimmune disorder called Hashimoto's. It's not
Wow.
your thyroid, it's your immune system. And
Right.
so you have to look at the family history. Is there evidence of immune dysfunction? Because again, these kids, they don't detox well, and they're susceptible to immune dysfunction. They're susceptible to that autoimmunity. And then we have to sit there and do the workup to find out, what is going on with this kid. Is it brain inflammation? Is it immune dysfunction? Do they have a gut problem? Do they have food sensitivities? Do they have nutrient deficiencies? Are they toxic? Right. And that's not, I'm making it sound easy, but it's not,
No.
as I like to say, that's why I have all this gray hair over
Right.
here. It's trying to figure all this stuff out.
Yeah.
And because you're dealing with such a diverse population, it can, make you pull your hair out. And invariably, like, I'm going down these rabbit holes trying to figure something out. And, a parent will say something like, oh, I heard gluten-free diets are good for kids. It's like, oh my God, we never talked about gluten-free diet. That should be number one, right? So it's always,
Yes, which goes back to the Roundup that they're spraying on the wheat that's causing all the, yeah.
Oh,
Mhm.
yeah. I mean, if you could just get kids on clean food, clean water, clean air, and I mean good food, right? Not junk.
Yeah.
Okay.
Hmm.
And fix their gut ecosystem.
Hmm.
Just that alone would do wonders for a lot of these kids, right? And then you have to look at, and this is really hard when you're talking about behaviors, right? So you got a kid that what do they call it? Oppositional defiant behavior.
Yes. Yeah. Yeah.
It's
Yeah. Yeah.
it's like, isn't that just a bratty kid that says no all the time? You know, but they make it a disease, right?
Mhm.
But the thing about any of these behavioral problems, and especially these kids that, they were okay and all of a sudden they're not, right? That they're okay and they're playing with their siblings, and the next thing you know, they're putting their fists through the wall. Oh my goodness, they have a behavioral problem and we need to send them to the psychiatrist, and they want to
Mhm.
put them on Abilify or, Prozac or Zoloft or whatever
Yeah.
drug they're using.
Mhm.
Without ever looking at, well, why is this kid like this? Were they, invented by the devil? I mean, what's your theory here? What's your mechanism of action? Why are they all of a sudden like psychotic? Because some of these kids get like they look like they're possessed.
Mhm.
And then when you say, oh, well, let's look at markers for brain inflammation. Gee, they're all through the roof. Well,
Mm.
how would you feel if your brain was inflamed? All right. Probably not very good.
Mhm.
And a lot of these kids are non-speakers, so we don't know how they feel.
Right.
They don't necessarily tell us. They tell us because by throwing a, chair through a window or something is how they tell us.
Mhm.
But we don't know how they feel. But, if you've ever had a migraine headache, I mean, you're not the most pleasant person in the world.
Right.
And the reason why you're not lashing out is because you're an adult and you know it's inappropriate and it'll cause so much, social damage and you don't want to deal with that. So you behave yourself even though you don't want to.
Mm.
So, again, this is the idea of looking at the child. And, I see adults too, so you can expand this to everybody, but looking at that kid in front of you and trying to take the symptoms, the behavioral symptoms you have, and distill those down into the biochemical process that's creating that.
Right.
And that's the art and the science of what we do and what we try to teach with maps. And it's very difficult, and it's a changing, moving target. It's changing all the time. But this is where, obviously we're very concerned at the rate at which these numbers are going up. They haven't, they started tracking them in 1992, I think, the
Right.
actual
Right. Right.
tracking. And it's gone up every 2 years. And, unfortunately, the last numbers we have that were 1 in 36, that's from a birth cohort from 2012. So that data is already 12 years old. If somebody
Right.
says, what's the rate of autism? And I say, for somebody born today, yeah, I have no idea.
One
I
in
have,
32 is the last one that I heard.
yeah, but
When
even,
Robbie was born in 1989,
okay,
and that's the year that they started putting needles into mercury, right?
yeah,
And that is when I heard the number started to jump, right? And he was the 1 in 10,000, right?
mhm,
So I've watched it go from 1 in 10,000, 1 in 5,000, 1,000, 1 in 500, 200, 100, 1 in 50, now to 1 in 30, whatever it is. And it's just mind blowing to me that the government or whoever is not seeing this as a pandemic. But then we get into politics.
no,
I don't want to get into that, but I
right.
just feel like big pharma, why would we cure everybody if we could just put everybody on medication?
I'm, I'm, I was preparing to do a talk in a few weeks, and I ran across, this was from CNBC from, I don't know, 2018 or something like that.
Mhm.
But hepatitis C, very serious disease, right?
Mhm.
50% of people that get it become chronic. Most of
Right.
those people are going to develop liver failure, liver cancer, something like that. So it's a very serious illness. And they came out with these drugs, and these drugs were incredibly effective at getting rid of hepatitis C. Like 99% of the cases gone.
Mhm.
Whereas before we'd be treating these people for a year, 2 years, 3 years, miserable the whole time, depressed, no quality of life. Now it's 3 months of treatment, which is
Mhm.
not all that bad, and it resolves. Now, it was like $80,000 at the time for a course of treatment. It was ridiculous how much
Wow.
they charged, but it was very effective. So the CNBC article was, is it really good business to cure people? You don't make money off a healthy person, right?
Right.
If we keep you sick with Hep C, we can just squeeze money out of your
Right.
insurance for the rest of your life. But if we cure you, it might be a high upfront cost. But if we cure you, we lose all that income. It's like,
Yeah.
oh my
That's
God.
why I always say they'll never find a cure for cancer because they make too much money off of it.
Yep. No, absolutely. So,
I watched I think it was on TikTok. Oh, it was a woman. I don't know who she was, but she was talking about the different color dyes, and red creates this behavior, blue creates these behaviors, yellow, green, whatever. Do you have any opinion on that? Have you heard anything about
well, I mean, I don't know if the individual color creates the behavior. I do know that every single food dye that's one of these artificial dyes, every one of them is a toxin. Every one of them, without exception. Okay, so the only non-toxic food dyes are the natural ones, like we're going to use beet juice or something like that, right? But if you're talking, FD&C red number 6, that's a toxin, and they're
that?
only allowed in food because the government says they're not toxic enough. In the quantities you're using in food, they're not toxic enough.
Oh,
The problem is that they're not toxic enough for whom. So maybe a Skittle or two is okay, but who's eating 1 or 2 Skittles? And these kids, again, back to that autism diet, food coloring, food coloring, food coloring, food coloring, multiple food additives. It's synthetic fake food, and it's all chemical garbage. And
right.
so you start adding these things together and you start creating compounds that irritate the brain. I mean, that's the problem with the red dye, right? Is that it is very irritating to an already irritated brain,
Wow.
and kids go off the deep end with it. So, but yeah, I'm not aware of, yellow doing this and red doing this. I just say they're all bad.
Yeah.
So,
Yeah, basically, I mean, and the US government allows things in our food that other countries have banned.
no, yeah, there's 10, 12 farm chemicals that have been on the list to ban for I don't know how long now, 15
Mhm.
years, and they keep taking them off. I mean, it's part of, again, it's part of when you look at health outcomes in the US, we have the worst. I mean, we just have, there's 29 industrialized nations. We are number 37 on the list for overall health outcome. We're number, I don't even know what for infant mortality. I mean, we're into the 40s and 50s on that one. We don't match anybody else in the world that has our wealth, and we spend at least 50% more based on GDP. We spend 50% more of our GDP on healthcare, and we have a bigger GDP than everybody else. So 50% of a bigger number is a really big number, and we have the crappiest outcome. And it's all because the money goes to pharmaceuticals. If when Obamacare came out, right, regardless of what you think about Obamacare, one of the things that they were trying to put in place was quality measures. They did have outcome measures, right? We're judged based on outcome measures, and you think, wow, it's a great idea. The healthier my patients are, the more money I get paid from the insurance companies. Absolutely. Why not? Right? If you're doing a better job, that should be recognized. None of the outcome measures had anything to do with the health of your patients. It all had to do with how many tests you ordered and how many drugs you prescribed, right? So, if you have a patient with high cholesterol, the outcome isn't measured based on do they have a heart attack and how long they live. The outcome is based on did you put them on a statin drug, right? Did you put them on a diabetes drug? Did you put them on a blood pressure medication? Did you, order the heart cath? That's what you're judged by. And so the whole system is designed, it's just this whole, I don't know what, just fetid mess that is designed to feed itself, right?
Mhm.
And I have to think, why don't the insurance companies do something about this? Because insurance companies, if you pay out benefits, you don't make money. They get paid based on a percent of what they pay out. So if they pay out more, they make more. So they're not even motivated to cut
No, it
costs.
always comes down to this.
Oh, yeah. And again, part of it is just corrupted regulatory agencies. I don't know much about the FAA or the EPA yeah, I know the medical stuff, right? And I know they're all, man, in bed with the people they're trying to regulate. I'm sure the same thing's going on with all the other agencies. I don't know, but I'm pretty sure if this one is the way it is, the ones I know about, why wouldn't it be that way with all the rest of them? And
Yeah.
it's really unfortunate because our government is supposed to be, they're supposed to be ruling at our pleasure. They're supposed to be taking care of us. You know, yeah. Hey, stop that.
You think so? Yeah. No, everything always comes down to the almighty dollar, what makes us the most money.
Yeah.
I'm glad that you brought up though, when we were talking about, what causes autism and everything, because I've always said my mother's generation, there was no autism. I didn't go to school with anybody. There's a couple kids that maybe today would have been diagnosed as autistic, but I don't know what, they just went to the resource room or something back then. But I always said it's something has happened genetically to my generation that is giving birth to these kids. And I couldn't figure out what it was, but the difference is I remember when the microwave was invented, right? I remember when we started putting everything in plastic. You see the change in all the food and everything. Now everybody just buys something, whatever you buy, frozen vegetables in a bag, in a plastic bag, and pop them in the microwave, where my mother used to cook everything on the stove.
No, and that's what I'm talking about. That's toxicity, toxicity, toxicity.
Right.
When I was born in 1960, and I like to say, all I had to deal was lead, mercury, and DDT. No problem. Piece of cake. All right. Because really heavy metals, lead, mercury, arsenic, cadmium, we actually have enzymes, mechanisms to detoxify those things because those have been part of our environment forever. What
Yeah,
is
so
not
that's what I'm getting at. What can we do? Like, how could we detox, right? Because all right, so we kind of all know that a lot of people say that the V has caused their kids autism, right? But all four of my kids received their inoculations, okay? And only one had autism, right?
No.
So there was a
Mhm.
difference in one over the others.
Well,
So
no, it's
so like you'll have some people that are like, I never gave, they never gave their kids any inoculations at all, and yet their kid still has autism, and they
right.
can't figure out, they can't figure that out.
No, again, this is back to the toxicity thing, the vertical
Yep.
toxicity.
Right.
And you really have to look at the lifestyle. Because again, in 1960, I know I'm not young, but I'm not that old, right?
Mhm.
So in 1960, we didn't have anything in plastic. There was no saran wrap. There was no Tupperware. There was, you bought milk in glass bottles. I remember right
Yes.
the damn store, hoping I didn't drop it because my
And
mom.
soda, also glass
Right,
bottles. Yep.
right. It was all glass bottles
Mhm.
and cans, right? So you didn't have plastic, and plastic wasn't in direct contact with food. There was plastic, but it was like jewelry and that sort of stuff. So,
Mhm.
but so now we have so much plastic, and it's not just the off gassing of the plastic into our food, or getting the BPA from the register paper, cash register paper, or wherever else that you're getting it from. The environment is full of microplastics and nanoplastics. So, you go to parts of the Pacific Ocean in particular, there's an entire sea of plastic waste floating in the middle of the Pacific Ocean. And what's happening there, you have the action of the waves and the wind and the sun, and it's breaking that stuff down into microplastics and nanoplastics. Then you have personal care products where they intentionally make these nanoparticles to make your shampoo nice and creamy, or your conditioner gonna condition your hair so it's nice and shiny. So they actually make these micro beads and nano beads. They're not made out of glass. Those nano beads are made out of plastic, right? And the
Mhm.
problem with nano is now you don't have to eat it. If you just put it on your skin, it gets into your body. And that poor fishy that's swimming around in the ocean is just absorbing that stuff into their tissue, because it goes right through the skin, right through the cell membrane, right into the nucleus of the cell. And then we eat that fish, that gets into our body. And there's no way you don't have anything that'll filter that out. All right. So these particles are too small. So there's no way to get rid of this stuff. And we've completely screwed ourselves. We do not have, I always say, given the choice between a plate of DDT and a plate of PFAS, I'll take the DDT every day because I can detox that.
Mhm.
The PFAS, as far as I know, we don't even have an enzyme to detox that. They did a study with a binder, cholestyramine. It's a great binder for toxins, but they did a study where they for a year, they had people take cholestyramine 4 times a day for an entire year, and they reduced the PFAS level by maybe 22%, right?
Mhm.
So, and that's somebody actively
What is
detoxing.
that? What's PFAS?
That's like Teflon and oh,
Oh,
don't ask me what it stands for because it's perfluoro, whatever.
okay.
But it's a forever chemical, so it stays in your body forever. It's found
Wow.
in firefighting foam. It's found in anti-stick surfaces like Teflon, stain resistant like the carpet, Wearmaster and Scotchgard and those kinds
Oh.
of water repellents. Found in like raincoats, that sort of stuff. I think they're
Mhm.
using something different now, but they were using it. I'm in Michigan. In Michigan, we had a company that made boots called Wolverine Worldwide, and they would cover the boots with this stuff to waterproof the boots, and all the stuff got into the groundwater. And then all of a sudden, we had all these cases of leukemia and lymphoma, much higher rates than they should. And they went and tested the water, and it was full of this stuff.
Wow.
So, again, don't use no stick pans, use ceramic, don't
Right.
use and don't buy anything that has, if it's waterproofed, find out what they used, right? Because
Mhm.
again, if this stuff gets into your system, you're not getting rid of it. But the whole problem with what you're talking about, I've got these kids, and we see this with families where one child has autism, and the parent thinks it may have something to do with environmental toxin, like a injection somewhere. But what they do is then they stop. Right. Okay. We're not going to do that anymore. So this child is autism. This child maybe had got a few and they have allergies, maybe some eczema, immune system's not so great. And then these two never got anything, and they're going to be the healthiest of the bunch. But even their health is dependent on mom. Again, it's rare that I'm going to do a family history, particularly of a kid that never had an inoculation, but they're on the spectrum. It's rare that I'm going to do that family history and I don't find autoimmunity, allergy, some screwed up immune genetics. Because again, it's not genetic in the classic sense, like Downs is genetic. It's
Right.
genetic in the sense of, how do you express those genes? So when you have an issue with an environmental toxin, what that does is it alters the way you express genes. All right. So just as an example, the whole thing with methylation is that if we have deficient methylation, we don't silence genes the way we should, which means genes are going to be expressed that shouldn't be expressed because we don't have enough methylation. Is that genetic? Well, technically, yeah, but we call it epigenetic because it's not the gene itself, it's how the gene's being expressed. That's what happens with toxicity a lot, where the toxicity will create a situation where the genetics are getting altered in terms of their expression, not actually causing a mutation, all right, but changing the way the gene's being expressed. So that's where you have a situation where, what mom's health when she's pregnant is really important. The environment itself is really important. And you just have to try and, my favorite thing is when a woman comes in and says, I had a kid on the spectrum. I want to have another kid. I know I'm at high risk for having another kid on the spectrum. What can I do? And the answer is, give me 6 months. Okay. Because, we take that person, and not just mom, but dad as well, but it's really mom, and detoxify, feed the mitochondria, get the system working at its peak level, because that's going to get the best environment to create the best outcome with a pregnancy.
That is the best advice I've ever heard. That's great. Get to detox the mom for 6 months before she gets pregnant.
I mean, you know how people get, it's like, oh my God, my biological clock is ticking. It's like 6 months, I'm going to stop your clock. All right. We're going to reverse your, I will make your body younger. You're not going to be younger, but I will make your body behave like it's younger, and you'll get better outcomes. And that's really, to me, that's the answer to the autism epidemic, is start with the parents.
Yes.
Parents healthy,
Yes.
and these kids, even, you got a kid that's robust, they can handle a lot more toxicity than the kid who isn't, and I always feel like, I mean, I know my genetics, I've done them, backwards, forwards, upside down, all that. But so I know my genes, and I know that I've got huge methylation problems. I have huge problems with my inflammation genes. I had allergies when I was a kid. I have gluten sensitivity. Where would I be if I was born today? Chances are, if I was, born to parents that weren't, aware of all this stuff, I probably would be on the spectrum. Right. And that's always the concern, because one of the things we've learned from spellers, this is the spelling to communicate kind of thing. One of the things we learned from spellers is not only are these kids not cognitively impaired, it's not even like they're normal. Most of them are really, really smart.
Yeah.
So are we destroying the best and brightest minds? Autism. Is that what's happening? Because that's really, really scary, right? Who's going to get us out of this situation? It's not the politicians.
No. So how do you detox the moms and the kids? I know I have a friend of mine, she showed me a spray that she sprays on her tongue or whatever. She's like, oh, this has cured autism. You should try it. So.
Well, remember, if you've met one kid with autism, you've met
exactly. I'm like, okay.
That N of one, that'll work for you. No, so that spray is probably something to detox aluminum.
Yeah. I think so.
So, hey, if aluminum is the reason, if aluminum's sort of a known neurotoxin, it can contribute to brain inflammation. If that's the reason why you're on the spectrum and you can chelate it with whatever you're using, then yeah, you'll get better outcomes. Again, when I first started, it was much more mercury, lead and mercury were the big things. And so we used different chelators. But again, we got the same sort of response. You'd have these kids that would respond really well to it, but only if that's what caused their problem, right? If you have, if you have autism because you have a completely screwed up gut, and you have, toxicity with, PFAS or one of these, forever chemicals, if that's your problem, then the chelator is not necessarily going to help you. Not a great example, because that spray is zeolite, and zeolite's actually a binder. So, it may help some of those other toxicities. So if I'm looking at somebody that's toxic, how do you detox? Number one, we look at some of the biochemical markers. Glutathione is one of these compounds, this is back to when I went to my first DAN conference, learned about glutathione. It's like, why the heck do I why do I not know about that compound, right?
Mhm.
It's like essential for life. You can't breathe oxygen without it. Every cell on this planet that uses oxygen has glutathione. It's that important. Why didn't I know about it? Most doctors still don't know about it, right?
Mhm.
But you should know what your patient's glutathione level is, because a lot of these kids, it's really low. So glutathione is not just help you detox oxygen. Glutathione also is one of the phase 2 liver detox pathways. So you break down a lot of things with glutathione. You break down alcohol with glutathione, but you break down a lot of environmental toxins with glutathione. So if you don't have enough glutathione, that's going to be a problem for your overall toxicity. Right. So you want to know that. And there are things we do to boost glutathione. This is N-acetylcysteine does it. Sulforaphane does it. There's lots of glutathione supplements. The trouble with glutathione, it's a tripeptide. It's glutamate, glycine, and cysteine stuck together. So if you just take it orally, your stomach goes, oh, protein, chop, 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 and all you end up with are the amino acids, right?
Mhm.
So the better way is to stimulate the liver, to get the liver to make more glutathione. And there are liposomal forms and topical forms and forms that get through your mouth, and IV forms. IV is great, but it lasts a few hours, so it's not something that's going to give you long-term benefit. But that's one thing. The second thing is to look at the gut, because we forget we have this entire ecosystem, and most farmers know this now. They're in the soil. The soil might have 5,000-6,000 different bacteria. We're lucky if we have 500 different bacteria, but those bacteria do things we can't do, right? They can break molecular bonds that we can't break, and some of those bonds are things like PFAS, right? So there may be bacteria that if we promote the right ecosystem, there's bacteria that can break down plastics, right? That can actually break down plastics. We can't do that, but there's bacteria that do that. So again, the gut's really important. And then the big thing we use are binders. We use other detox methods. Binders are just anything that will bind the toxin, keep it in the gut so you poop it out,
Mhm.
because the liver is forever getting these toxins from the bloodstream, putting them into the bile. It goes in the intestinal tract. The trouble is most bile is reabsorbed, and when you reabsorb the bile, you just reabsorb the toxin. So the idea behind the binder is the bile comes in with the toxin. The binder will grab that toxin from the bile, so when the bile gets reabsorbed, the toxin's not there anymore. The binder holds onto the toxin, you poop it out. All right. So that's the way you can decrease it. And there's natural binders, clays, charcoal, the zeolite, which is a volcanic ash. All those things are binders. And then there's prescription medications. The biggest one is cholestyramine. But that's the binding method. And then there's lovely things like saunas. You can sweat out
Huh.
almost every toxin. All right. So and they've done these studies with saunas. I mean, after 9/11, you had all these first responders. Oh my God, they were toxic to beat the band. Those buildings went down, and it was
Mhm.
asbestos,
Yeah.
lead, all the stuff that was in that building. And they just, all these first responders are he-men, even the women are he-men, and
Mhm.
and respirator, I don't need no stinking respirator, so they're full of this stuff, right? And they actually did sauna studies where they checked urine and blood levels before and after and show that they reduced. And then when they got out of the sauna, they would scrape the sweat from their skin and they would analyze the sweat, and it was full of these toxins.
Wow.
So it's not, voodoo, tree hugging, hopeful therapy. There's science behind it, and it is a way to detoxify. And you can get a kid in the sauna. The only thing with a kid is because their body surface area is much greater relative to their mass, they're going to heat up faster, right?
Mhm.
So, an adult, you may have to sit there for 20 minutes before you start sweating. Kid's going to start sweating in 5. So you just don't want to overdo it with a kid, but that's a great way to do it. And then just real simple things like Epsom salt baths. Epsom salt it's magnesium sulfate, and the sulfur in there is very detoxifying. And if they don't want to soak in a bathtub because it can dry the skin, well, then put their feet in a dishpan with that stuff in it.
Oh.
So all these things are ways for kids to detoxify. So again, if you say what causes autism, and my answer is toxicity, right? That, all the things that happen with toxicity, the autoimmunity, the inflammation, the deficient connections, the messing up the gut, messing up the immune system. If that's really the issue, then those are the ways you detox. Do you need chelation? Do you need better glutathione and liver function? Do we use binders? Do we throw you in a sauna? Do we do Epsom salt baths or any of these foot baths they have? They've all been shown to decrease toxin loads.
Mhm. Wonderful. Okay. So if someone wants to see you as a doctor, I guess they'd have to live in Michigan to do that. But if they want to see someone that does what you do, where do they go? Is there any type of a website? Like, does MedMaps, like, do you
Yeah,
have access
we
to other doctors around the country?
Right. We have a directory, clinicians directory, and in that directory, it'll say, did they, are they a member? Did they come to one conference? Did they come to 20 conferences? Sort of the highest level of training is the fellowship. Are they fellow of MAPS or not? So, are they faculty? So you can get an idea of who's in your area, and then also how much experience they have. For my practice, we do see people out of state. I'm licensed in Michigan and Florida. We do see people out of state, but we do require at least once a year that they come in person. So that we do lay eyes on them. But with the advent of things like Zoom and video conferencing, it's sort of opened that up for us. Because I do not take insurance, it opens things up quite a bit, because at least in the state of Michigan, it's the insurance laws that don't allow you to see somebody from out of state.
So you can do virtual.
Yeah, again, providing they're coming at least once a year to see me. So we do a lot of people out of state. Now, I can tell you that, if you call my office, it's going to be 6 months to get in to see me, because we're that busy. I've got 3 other nurse practitioners that work with me. One of them's up to speed. The other 2 are working on it. But, again, if you go to MedMaps, and it's just medmaps.org is the website. If you go there, look at the clinician directory, see if there's somebody in your area, and see if it's a good fit for you. So that's the best way to get to it.
Okay. So the best way to contact you would to be through the MedMaps?
Yeah, you can do it through there. The other, my office is called Bioenergy Medical Center. So the website's just bioenergymedicalcenter.com. If you Google me, if you Google Dr. New, NEU, and you get past all the quack watch and this guy's crazy citations, you'll find me in there somewhere.
It's amazing, isn't it? How they just try to, keep people
I've
from getting
learned,
healthy.
listen, I've learned if your medical board hasn't gone after you, if you're not on quack watch, you're nobody. Those are all badges of honor as far as I'm concerned.
That's funny. All right, wonderful. All right, thank you so much for taking time out of I know how busy you are. It took me a while to get you to do the interview. But I really, really appreciate it. And thank you so much for being here today.
It's my pleasure. I always enjoy doing this and getting that word out. Appreciate it.
That's it for today's episode. I hope you enjoyed listening and it helped you gain a new perspective. To learn more about our children's book series, Robbie's World and His Spectrum of Adventures, or to learn more about what we do at Robbie's World Foundation, simply visit our website at robbiesworldbook.com.
Thank you for joining us today. Be sure to join us again on our next episode of Spectrum Perspectives.